any remarks that she might have at the conclusion of mine. Since our designation is a high hospitalization area under the governor's orders, we've been with multiple discussions with state officials relating to vaccines for Bell County over the past several days. The objective was to acquire more vaccines so that we could expedite the state vaccination plan here in Bell County. You may have noticed a posting on the Department of State Health Services website on Sunday that advised that the state had identified 28 what they identified as 28 large vaccination hubs across the state. These large vaccination hubs will receive large outlays of vaccines beginning week number 5 of the state's allocation and distribution plan for vaccines. The DSHS website advised that a total of 158,825 doses would go to these hubs based on the number of people each provider estimated they could serve over the course of 7 days. Bell County was designated as one of these 28 providers and one of 18 counties to be a large vaccination hub. The DSHS website also identified the number of vaccine doses that we could expect here in Bell County. That was listed at 3,900. As we advised you at 11:45 a.m. this morning, the 3,900 Pfizer vaccine doses have arrived in Bell County. The Pfizer doses are currently in the possession of the Bell County Public Health District and are being ready for inoculations beginning tomorrow morning at 9 a.m. at 2 locations in the county. Here are the details for our 2 Bell County vaccine centers. There will be 2, and as I just mentioned, they will be opening at 9 a.m. tomorrow morning. The Killeen Vaccine Center will be located at the Killeen Community Center, 2201 East Veteran Memorial Boulevard in Killeen, and the Temple Vaccine Center, located at the Salmon Center, 2220 West Avenue D in Temple. Both vaccine centers will operate by appointment only. Please do not attempt any walk-ins as you will be turned away. Please don't show up more than 15 minutes before your appointment time. We'd like to do our best to avoid lines, maintain our social distancing protocols during the process. Your assistance in observing your appointment time will aid greatly in that effort. We want to get you in and out of the vaccine center as expeditiously and as safely as possible. There will be approximately 25 to 30 individuals staffing each site, the positions ranging from clerical and administrative to vaccine inoculators to security and medical personnel. In order to facilitate this process in the most orderly and efficient manner, the Bell County Public Health District has updated its website, which formerly had a link for individuals to register for vaccinations. The new link is now more than a registration site, but it is also an appointment booking site. Once an individual completes the form, an appointment is generated into the system and emailed to that individual. Individuals are requested to print off that confirmation when they receive it, bring it with them at their appointed time and day. If you do this, this will help expedite the process and expedite your process through the vaccine center. The Bell County Public Health District website is www.bellcountyhealth.org. As we currently have over 4,000 individuals registered, we will be scheduling those individuals first, and will continue the first come, first served basis following the state guidelines and protocols for vaccinations. Again, these vaccinations will begin tomorrow morning at 9 a.m. Appointments will be made in 15-minute block increments and continue throughout each day. A block increment scheduling simply means that more than one person will be scheduled in that time block. This will allow us to schedule multiple individuals at one time and process them quickly through the vaccination center. Our goal is to vaccinate approximately 560 individuals a day, or about 3,900 a week. A couple of final comments. We will be opening a vaccination center hotline. This phone number will be staffed from 9 to 5 Monday through Friday and will be available to answer questions the public may have about the vaccine centers and the process. The vaccine center hotline number is 254-933-5203. Again, that number is 254-933-5203. That number is now active and ready to receive calls. I also want to say, or close with this, depending upon our future vaccine allotments from the state, we may well open up other vaccine centers. A lot will depend on supply and, quite frankly, how well we demonstrate to the state that we can vaccinate 500 plus individuals a day. I believe with your cooperation and help, and the help of all of our residents in Bell County, we can do this and we can do more. But we need to demonstrate that we can. Finally, none of this would be possible without the cooperative efforts between the Texas Department of Emergency Management, and I'd like to say special thanks to Chief Kidd at TDM, the cities of Killeen and Temple, the cities, and in particular their fire and rescue departments have been very helpful in this effort. We honestly could not do it without them. Our healthcare partners in the community, Baylor Scott and White, Advent Healthcare, Seton Medical Center, I appreciate the resources that they provide and continue to provide, not just to our healthcare workers in those facilities, but to our residents across the county. Of course, it cannot go without saying that our Bell County Public Health District and our Bell County Emergency Management team are also key and critical partners in this effort. I also want to make mention of Bell County Tech Services. They deserve a special mention for their work in this process, especially for working on and developing in very short order a scheduling and booking program really within hours of being asked to do that. So I very much appreciate their help on this. At this time, I'll recognize Dr. Chadwell, and if she's got any comments or remarks that she'd like to make, I would defer to her. Dr. Chadwell?
Yes, can everyone hear me?
Yes.
All right, the only things I would add, just pointing to a couple of items on our website that I want to make the public aware of as we undergo this effort. The first thing is that, as the judge said, we are making those waitlist registered individuals available for appointments first. So that link is going to go live as soon as those individuals have been given an opportunity to make an appointment. There's a placeholder for where that link will go as soon as we get it up there. So you will be able to see where that's going to be available as soon as we have it up. The other points that I wanted to make on information on the website that will be helpful to you, there is a fillable PDF document of the forms packet that will be available certainly on site at the vaccine centers, but it is available to you to download, complete, and bring with you. That can expedite the process, so please take a look at that if that's something that you'd like to do. Certainly happy to have that available to all of you. Now, we did receive the Pfizer vaccine. We did not receive Moderna. We have had a lot of people asking us questions about which vaccine. Some people have a preference toward one or the other. So what we did receive is Pfizer. The fact sheet is available on the website as well. I do encourage people to please go to the website and take a look at that in advance. And if you have any questions, certainly you can email the COVID inbox, covid@bellcountyhealth.org, to ask those questions about that vaccine. And that's all I have at this moment in time.
Thank you, Dr. Chadwell. All right, at this time I'll open it up for questions, if there are any questions. Go ahead.
If I may, sir, in this question...
Tell me your name again.
Oh, sorry. My name is Alex Gibbs, and I work with KWTX.
Alex?
This question can be both for you and Dr. Chadwell. So obviously you know that the vaccines will be distributed to the state recommended 1A and B required people. We also know that you guys are also going to be doing your best to vaccinate those that were also on the previous wait list that was taken down. So let's say I am neither of those people and I would like to get my vaccine as soon as possible. Could you talk a little bit about what the timeline would look like as far as how soon I could get a vaccine?
I don't know if everybody could hear the question, but I'm going to paraphrase it, and then you tell me if I misparaphrase it. The question was along the lines of, for those folks that are not eligible at this time under the state protocols, what's the process and timeline for those folks, or what could they expect? I'll give you a response, and I'll ask Dr. Chadwell to jump in and correct me anything I misstate. As Dr. Chadwell just mentioned, we're working through the list that we have currently right now, which is over 4,000 individuals. Those individuals have declared that they are eligible under the state allocation guidelines at this time. If you do the math, with 3,900 vaccines, we're going to be scheduling in 15-minute increments. The centers are going to be open from 9 a.m. to 9 p.m. 7 days a week. We're going to vaccinate in accordance with those protocols and those priorities. We'll get to everybody who's eligible based on a first-come, first-served basis and based upon supply. So as long as we have supply and folks are eligible under the state plan, they will be scheduled. In terms of a timeline, again, if you do the math, if we do about 500 today, which the target is actually a little higher than that, but just for round numbers, 500 a day, in 7 days, we'll do 3,500 vaccinations. So if we have 4,000 on the list right now, it's going to take us about a week and a half to get through that list. And then depending upon if we, as the list opens back up on Thursday morning and folks are allowed to sign in, you can just calculate 500 a day. We have a little less than 400,000 residents in Bell County. So that's my response to that question. I'd be happy to see if Dr. Chadwell has anything to add.
The only thing I would add is I think part of the question was when should the general populace be expecting to be eligible, and that's really more up to the state than it is up to us, so I can't say when that will be. Right now we're just going by the state is saying this is the group that's eligible, so that's what we're going with at this point in time.
But again, when an individual can expect to be vaccinated depends on their status under the state plan and on the availability of the vaccine.
Well, I have you just one more question, if I may, and I know this might sound like beating a dead horse at this point, but especially as more and more vaccinations begin to come to the state of Texas, to Bell County, especially to all of our local hospitals, so on and so forth, can you continue to stress the importance of whether you've received the vaccine or not, the importance of continuing to social distance, the importance of continuing to wear a face mask and to follow social distancing guidelines as much as possible?
I would just repeat what you just said. All of those things continue to be important. Again, for those who may not have heard, the importance of following the COVID health protocols that our health authorities have been recommending for months. Social distancing, wear your face covering when you can't social distance, personal hygiene, wash your hands frequently. All of those things continue to be in play. As I just mentioned, if you do the math, it's going to take us several weeks, months, to get through the entire population. We will consider opening again additional vaccine centers as resources allow us to do that and as vaccine supply allows us to do that. It's my hope that we're very successful these first week or two and we're able to meet or exceed the goals we've set for the number of inoculations we'll do on a daily basis and on a weekly basis. I think if we're successful in that and the state receives more vaccines, then I think Bell County will receive more vaccines and we'll be able to expedite this process. But nonetheless, we have a lot of residents to inoculate and it's going to take some time to do that. So while we're doing that, it is very important that we continue to practice those health protocols that our health officials have advised us to do. Dr. Chadwell, do you want to add anything?
I don't think I have anything to add to that. I think you've hit the nail on the head, as it were. But just, to point out to everyone, it is a 2-set vaccine dose. One part of that vaccine is not going to fully protect you. And after that second dose, there's a period of time you have to wait before the full effect of that vaccine comes into play. So it's going to be really critical, yes, to keep practicing those measures as we get through this process, even after you received your first dose.
All right. Any other questions?
Yes, sir. This is Andrew Moore, Channel 6. Can you hear me?
Hi, Andrew. We can.
Thanks a lot. For those 4,000 people that already signed up, I believe, if I remember right, some of those people fit into phase 1A and 1B, and some of them did not. Are even the people that did not fit into phase 1B on that list, they're still going to be able to go first in this process?
No, those individuals that did not indicate that they fit into the phase 1B or the first responder tiers are not going to be receiving invites just yet. Only those that indicated they fit the eligibility criteria currently are receiving those invites.
And then if you're going to have about 4,000 people there and you're going to be able to vaccinate a couple hundred a day, when do you anticipate that link going up on the website so more people can register?
We're anticipating right now that the link will be reopened at 9 o'clock on Thursday morning.
Okay. So that's when additional people can start signing up for this?
That's correct. And you said 200 a day. We're targeting 500 a day.
Or several hundred, yes. And then what was the Temple location?
The Temple location is the Salmons Center, 2222 West Avenue D, as in David.
Okay, sounds good. And lastly, just so last week, you guys didn't know when you were going to exactly get this vaccine. It seems like in less than a week, all of a sudden, guess what? You are a hub designated by the state. You said that the tech team helped you get a website for this, or a website section for this in hours. I mean, what was it like going through that process of finding out, okay, we've got our vaccine, now all of a sudden we're a hub, now all of a sudden we have to set all this up in just a few days? What was that like?
There was no lack of excitement associated with that process. Staff that's in the room right now are chuckling. I really do want to commend all of the staff, all of the entities that we work with, the city folks, county folks, our hospital administrators, hospital team, resource folks, just a multitude of folks that came together in a very short order of time and have put together operational plans for some logistics that really are unprecedented in terms of trying to inoculate the number of people that we're going to do in the short order of time that we're going to do, with the anticipation that there's more to come, that these vaccines may be arriving in greater quantities, with the expectation that we do those in greater quantities. So certainly a huge challenge, but I'm very proud of the team that stood up and the work they've done, and look forward to getting operationalized tomorrow morning.
Are there any other examples of how quickly you had to put this up, like that website?
Examples of, well, just again, I'll mention Texas's. As we started working the conversations with the health district about their existing website, their existing registration process, it became apparent that that process was not going to be adequate and could not be scaled to the degree that we needed to scale it going forward. So our tech services team, really in a matter of hours, was able to create an application that we can use going forward. I think there'll continue to be improvements to that as we go forward, but certainly something we can get out the gate with, and something that I think will be effective and efficient for us.
And did you guys find out on Friday? Or when did you find out you were designated as a hub?
I'll get James to shoot you a note back with the exact date and time. The days over the past 4 or 5 days have kind of all run together for me, so I can't tell you exactly what day and time that was. I can tell you that it was a series of conversations in the evening, but I don't remember what day that was or what night those conversations occurred with the state, but it was a few days ago.
Okay, well, thanks so much, Judge. Amanda?
Any other questions? Let me say one more thing. I want to highlight that phone number again for you. Again, our vaccination center hotline phone number, if you have questions about the vaccination centers or the process, or if you need some help. For example, if you don't have a computer or you don't have access to a computer, if you will call this number, we can provide some assistance in that regard. So contact 254-933-5203. Again, that number is 254-933-5203. All right, if there are no further questions, I want to say thanks to those that dialed in. Thanks for those that are here. Thanks again to the staff that's going to make all this work. We look forward to getting this process underway. Thank you very much.